Good day. I am Schultz Tuplano. I will be presenting my research about the factors affecting the work-related stress and burnout of healthcare employees in Eastern Bicol Medical Center. Studies often identify burnout as a nursing outcome. Yet, burnout itself, what constitutes it? What factors contribute to its development and what the wider consequences are for individuals, organizations, or their patients is rarely made explicit. We aimed to provide a comprehensive summary of research that examines theorized relationships between burnout and other variables in order to determine what is known and not known about the causes and consequences of burnout in nursing and how this relates to the burnout. Chapter 1: The Problem. The past decades have seen a growing research and policy interest around how work organization characteristics impact upon different outcomes in nursing. Several studies and reviews have considered relationships between work organization, variables, and outcomes such as quality of care, patient safety, sickness, absence, turnover, and job dissatisfaction. Burnout is often identified as a nursing outcome in workforce studies that understand the effect of context and in on outcomes in healthcare environments. Statement of the problem. What is the demographic profile of the hospital healthcare employees in EBMC? What is the health and performance status of EBMC healthcare employees? What causes work-related stress and burnout of EBMC hospital employees? Is there a significant relationship between the demographic profile, health status, and performance evaluation to the stress and burnout of the health employees of EBMC? What strategies can be done to enhance the development and to have a successful approach of work-related stress lessening program of EBMC? Assumptions of this study. The respondents may have health and personal issues that may have effect on the stress-related behaviors. The burnout and work-related stress may affect duty performance of respondents, resulting in poor health care services. There is a plan and approach to identify the factors affecting stress and burnout of hospital employees in ABMC. Hypothesis. There is a significant relationship between the patient's urgent need for healthcare services and fear of medical flow on the stress and burnout of healthcare employees. Significance of the study. To evaluate and compare the work-related stress and burnout among health employees in EBMC. To identify the factors that affects the level of performance of respondents in relation to the stress and burnout experienced by respondents. Gain awareness to be used for health advocacies. Use as a reference by other future researchers. Scope and delimitation. The focus of the study will be the hospital healthcare employees of Eastern Bicol Medical Center and the experienced work-related stress and burnout. The study will start on January 2025. The data of the study will be obtained through a self-made questionnaires. Convenience sampling will be used to determine the respondents of the study. The focus of the study will be the respondents' response, their nature of work, and assignment and work status. Chapter 2: Theoretical and Conceptual Framework. Synthesis of the state of the art. A review of related literature of the research focus is conducted to establish similarities and differences with the present study, which will be helpful and relevant in the better understanding of the study. Self-related status has been used as a measure of how an individual perceives his or her health by rating it as excellent, very good, good, fair, or poor. Considering that the socioeconomic status is the most important determinant of health-seeking behavior. Theoretical framework. This study is based on the health belief theory. The health belief theory model is theoretical model that can be used to guide health promotion. It is used to explain and predict individual changes in health behaviors. It is one of the widely used models for understanding health behaviors. Conceptual framework. The present study employed the input process output model of conceptual framework. The input consists of the profile of the respondents in terms of age, sex, civil status, educational attainment, and family monthly income, as well as self-rated health status and behavior of BMC medical staff. The research process composed of the data collection through questionnaires as the primary data gathering tool, with documentary analysis and interpretation of the collected data, the test for significance, and the formulation of proposed plan to improve the health status and health behavior of EBMC medical staff. The output is for three program to enhance the development and approaches to stress and burnout lessening in EBMC. Conceptual framework. We have the input, the process, and the output. First is the input. You can see here the profile of the respondents with regards to his age, to the sex, civil status, educational attainment, hospital position, assigned ward or station. For the process, we have the collection of data, questionnaires, documentary analysis, interpretation of collected data, test of significance, formulation of proposed plans to identify and lessen the work-related stress and burnout. And for the output, program to enhance the development of approaches to stress and burnout lessening in ABMs. Chapter 3. Research and Methodology. Locale of the study. The study will be conducted at EBMC or the Eastern Bicol Medical Center in Virac, Catanduanes. Respondents. The respondents will be the medical staff of Eastern Bicol Medical Center. Data gathering tools. Questionnaire. A questionnaire is a research instrument that consists of a set of questions for the purpose of gathering information from respondents through survey or statistical study. A research questionnaire is typically a mix of closed-ended questions and open-ended questions. A questionnaire is a list of questions or items used to gather data from respondents about their attitudes, experiences, or opinions. Questionnaires can be used to collect quantitative and or qualitative data or informations. Questionnaires are commonly used for the market research as well as in the social and sciences. Validation of the questionnaire. The self-developed questionnaire that will be used for the research study will be tested for validity in order to ensure for effectiveness and non-biased. Administration and retrieval of questionnaire. A letter of request will be sent to Eastern Bicol Medical Center Chief of Hospital in order to seek permission to conduct the study among the medical staff of the hospital. A self-developed set of questionnaires will be administered to the target respondents and will be likewise be collected during the administration of the questionnaires. The statistical treatment of the study. To analyze the data that will be derived from the administration of the questionnaires to the respondent, various statistical tools will be used. The statistical tools that will be used will include the following: percentage technique, weighted mean, Likert scale, and person product moment correlation coefficient. Statistical tool. So it's the weighted mean, percentage technique, Likert scale, person product moment correlation coefficient. That would be all. And thank you so much.